For the agent that must be in the know, Medicare Industry Insider discusses critical insight, noteworthy trends, and upcoming issues in the Medicare market.
Deciphering and debating the legislation, regulation, and what's happening in the market. I'm Chalon Jackson.
And I'm Rachel Bremeyer, and we're going to talk shop, dive deep into these complex topics, and make them understandable and actionable.
If you've ever wondered where the world of Medicare is going and how to prepare for the future, Medicare Industry Insider is the resource you've been looking for. Welcome to this episode of Medicare Industry Insider. I'm Chalon Jackson.
And I'm Rachel Bremeyer. And today we're discussing telehealth.
Absolutely. Telehealth, of course, been in the news a lot lately with the end of the pandemic earlier this spring and that public health emergency. There was a lot of things up in the air about whether or not telehealth would even continue.
Mm-hmm.
Of course, we got a little bit of a reprieve through nearly the end of the year, but the future is still a little uncertain. And I think not just the future of access to telehealth, but the big and overwhelming question is, does the kind of promise and opportunity of telehealth outweigh a lot of the potential risks that it presents to clients and to health practices?
100%. It's definitely something that we are going to be looking into a lot on this podcast. But if we kind of back up a little bit into terms of statistics, 3/4 of Americans surveyed said that the pandemic has made them more eager to try virtual care. And 1 in 4 Americans over the age of 50 had used virtual healthcare during the first 3 months of the pandemic. So we're looking at a very large percentage of people who maybe previously were not interested in telemedicine, and because of the pandemic pushing them to try virtual and technologies and everything like that, they're way more open and willing to try things like telehealth.
Yeah, absolutely. And I do think, one of the big things is talking about some of the opportunities in telehealth, what kind of services are being provided. I think the vast majority of us have probably used telehealth to, get a case of strep throat diagnosed, or, a kid that's snot is a funny color and you need to know.
Or like
whether
my
to go to the
husband
doctor.
who got hand, foot, and mouth, and we didn't know adults could get that, but he was able to send pictures of his bumps on his hands, and they were like, yep, that is definitely hand, foot, and mouth in adults. So
absolutely,
it was a nice way to get that diagnosed in the middle of a holiday, actually. We were in the Christmas season where, do you want to go to the ER during the holidays? No. So It's a good option for that as well.
Well, and I think that's really the big discussion to be had. That was kind of the past of virtual care, kind of the initial use cases were things like that. But as we continue to see virtual care transition and develop, now we're starting to look at more things like maintenance care, long-term solutions for chronic health conditions, things like remote patient monitoring and, regular virtual care meetings with everything from mental health professionals to nutritionists to other service providers to help deal with more chronic illnesses. And I think the big overwhelming question is, how effective can that be? I'm thinking about all those, Friday afternoon virtual meetings that pop up on your calendar, and whether you actually want to go and whether you're really going to be that engaged. So I think there's still a lot of unanswered questions in how effective something might be in terms of working with folks who have chronic long-term health needs, as opposed to those kind of one-off virtual urgent care type cases.
Yeah, so we will definitely dive into that. You had mentioned earlier too on COVID and the personal health emergency. So as the personal health emergency kind of wraps up, that was definitely one of the big topics, is do we want to continue telehealth or not? Because it was basically being billed the same as inpatient visits, looked at as an inpatient type of visit. And they were able to even prescribe quite a few drugs telemedically as well. What we're seeing is that it's been effective, and they're looking at it thinking, let's kind of delay this a little bit longer. So even though the personal health emergency has ended, we're going to continue to see telehealth through at least the end of this year. And they're going to extend the pandemic era policy until November 11th, which means that they're able to prescribe prescription drugs like Adderall as they would have in an in-person medical appointment as well.
Absolutely. And I think access to care is really the kind of the big overwhelming thing, especially when you talk about some of those controlled substances where, normally it takes an in-person appointment. Being able to prescribe those through telemedicine definitely presents some challenges and risks,
Right.
but it also provides access to a lot of people who may not have previously been able to access that type of care. And in terms of access and where you receive care, one of the big kind of knocks against telehealth right now is, and this has been a talking point in all aspects of healthcare, are site neutral payments, where if you're getting a telehealth visit or at a doctor's office or at a hospital, what fees are appropriate. If your doctor's office standing alone is owned by a hospital, does it really make sense for that hospital to charge a facility fee? That's really, really up for debate right now. I think what's less up for debate, but has been happening and caused some major scrutiny, is a lot of hospitals are offering telemedicine services and then applying those facility fees to those billing charges.
Right. And I think that's where a lot of the dilemma gets into play, because a lot of the times the doctors are independent doctors that work through a medical school, for example, or a hospital. So they're the ones answering the phone. They are the ones billing for that appointment, not the hospital. So if the hospital is going to stay in business, they kind of have to charge that facility fee. But did you actually go into the facility? No.
Sure.
So it's definitely something that's up for debate, because if our hospitals want to continue to stay open and offer this service, they've got to charge something. But is it ethical?
Absolutely. And I think a lot of it comes down to, a couple of different things. One being, is this telemedicine care being outsourced? It's one thing if you call into like a teledoc style hotline where you could be talking to a doctor from anywhere in the world, anywhere in the country at least. It's another thing if you call the local hospital for a telemedicine appointment, and what level of disclosure is required for them to tell you, hey, you're not actually talking to one of our doctors, it's someone from somewhere else. And at that point, as you said, maybe that contractor is the one getting the actual billed fee, and that facility fee is the only thing going to the actual hospital facility. Otherwise, they don't get paid at all for that visit. But one great example, Children's Hospital of Colorado does not employ their own doctors for telemedicine. Those lines are staffed by doctors from the University of Colorado Medical School. So medical school doctors charge for their services, and then that facility fee goes actually to that children's hospital, which to an extent makes sense. But I think the bigger question here is not just quality and continuity of care, but to what extent do people have a right to know where that doctor is actually located, and that those fees are not actually going to the hospital that they think they are talking to? And furthermore, something I know,
need to pay those fees because they didn't even go to the hospital.
Exactly. Is that, at that point, your facility fee, which, depending on the facility can be, into a couple $100, is that really worth it for what amounts to a referral fee? And as we'll discuss later, some potential major issues with privacy and security.
Yeah, for sure. The first thing, though, before we jump into that, one of the big questions we originally were asking is it hurting or helping care?
Sure.
And that's something that we definitely had a lot of debates ourselves when we were sitting down looking at creating this podcast. Because you look at, for example, mental health. That's definitely one of the big ones that they keep going back and forth of, is it good or bad for this particular situation? Looking at some statistics, so people who are suicidal, for example, are 4 times more likely to have remission in a controlled group when they were doing some studies than if you had not called a telemedicine and talked to a doctor. So in that case, that was something that proved that telemedicine is definitely helping mental disorders. But you never know. We're very new into this telehealth option. There hasn't been that many studies.
Sure.
So trying to figure out, is it actually helping or hurting care, for example?
Well, and I think it's a lot about how care is delivered in mental health specifically. So much of a mental health professional's job is seeing the things that are
Hmm.
unsaid, looking at body language,
Right.
posturing, things like that. It's long been known and said that only a small fraction of communication is done by the words we speak.
Hmm.
So I think there's a huge aspect of that where there are challenges presented by telemedicine. Now, of course, we can do video chats and things like that when people have that access and ability.
Right.
But I think what a lot of mental health professionals voice is that it does present challenges in
Hmm.
not being able to get the full picture of someone's mental state without being in person with them. So I think that definitely causes some issues. But the biggest question here in terms of hurting versus helping really comes down to access.
Hmm.
In most areas, I know we've talked a lot on various episodes about access to care in rural areas, or even in, say, heavy metropolitan
Hmm.
areas. It's really a providers per population
Right.
issue. Are there enough providers for the percentage of people that need that care?
Hmm.
And for
So
mental
that's
health,
actually a good.
frankly, no.
Yeah, that's actually a really good point because when a previous episode, we went into basically hospitals and doctors ratioed out to people. And sometimes there's not enough doctors, there's not enough hospitals for a rural area.
Sure.
This opens up people to get care that they may have gone, "Ugh, I've got this issue, but I'm not driving 2 hours to try and get care." But if they can pick up the phone and say, "Hey, I just want some advice, tell me what's going on," and maybe they call, their pharmacy and get their medication and they get to go pick it up down the road, they're more likely to get care in that particular situation. But then you go back into, do they have the technology to have an efficient and effective telehealth
Sure.
appointment? Because you run into where maybe they don't have enough broadband internet to have an actual virtual appointment. Now they're over the phone, and you're missing out on a lot of the visuals of a normal appointment. We even pulled a quote from a social worker, and she said that therapy is all about communication over the phone. Part of the therapist role is taken away when therapists can no longer comment on their client's body language. So, I mean, that is a huge part, is just being able to see and hear. And sometimes it's a weird body language. You're like, you're saying this, but this is not what you're actually saying. And they're not getting that
Mhm.
if you're just over the phone. So, yeah, I mean, it definitely is something to consider.
Yeah.
It could hurt or help. Hurt
Definitely
or help.
allows more access, more options
Mm-hmm.
to. I think one of the big things that allows you, telemedicine does allow the option for mental health to
Mm-hmm.
be kind of escalated or de escalated a little more rapidly. Whereas if you, say, need to see an actual, psychologist, psychiatrist that's, going around finding someone, trying for potentially months to get an in person
Right.
appointment, and then finding out, well, maybe the psychiatrist thinks you just need, um, you know, say a lower level of care with maybe some group counseling or something
Mm-hmm.
like that. Well, then you have to go and find a
Real.
whole new provider. And telemedicine definitely makes that a little easier to
Mm-hmm.
kind of go both ways, de-escalate down to maybe counseling or group sessions, or escalate up
Mm-hmm.
to talking with an actual psychotherapist. So I think there's a lot of opportunity there to shorten that window of people actually getting the help they need.
Mm-hmm.
But again, it depends on how this care is being delivered, through whether through a hotline type
Mm-hmm.
service that's not tied to a particular provider, or if providers, like we already mentioned, are outsourcing this. It presents some real issues with continuity of care.
Yeah. That's a good point too. If you're calling up, maybe you're just needing someone to talk to,
Sure.
you could potentially be talking to a different provider every single time and not realize if they're not communicating. Hopefully they are communicating, but they're not communicating. You could be getting prescribed drugs that potentially are like conflicting with each other and causing more harm than
Yep.
help. You could potentially run into two completely different diagnoses. You could potentially run into having to start from ground zero if it's a mental health issue, and causing more struggles and stress of trying to make sure that that person's up to date and knows the full story. That's part of when you go to a mom and pop physician. If you're down the road, they know who you are. Maybe they've taken care of you since birth. Who knows? And now all of a sudden you're getting lots of different doctors with lots of opinions and lots of different backgrounds and training as well. So that's another really big issue that you brought up right there. And then in addition to that, a lot of the telemedicine is stored in the cloud, is stored on different sites, on different platforms. So how safe is your personal health information if you're calling into that? Is it being recorded? Where are they storing the recordings? Are they keeping any information on your prescriptions, on your background? Where are they putting that?
Sure.
And I don't think there's enough, there hasn't been enough monitoring of where that is and how it's stored to really know if it's fully safe. We've seen so many breaches recently too.
Well, and I described it to someone this way, one of the big things about telemedicine for physicians was it allowed them to keep working or work more effectively during the pandemic when they maybe had to close their practice for a while or things like that. They could work from home, and that was fantastic, and it helped a lot of people get the care they need. But in terms of data security, while it wouldn't affect, a huge number of people compared to some of the large breaches we've seen, patient privacy is only as secure as each individual doctor's home Wi-Fi network.
Right.
And that's one of the big issues is, depending on the systems they're using, what service they work for, whether it's a local practice or, big telemedicine service, there's a lot of variability and not a lot of oversight in security standards beyond just general HIPAA guidelines.
Right. And it actually just brings up a story that I was thinking of because my dad was a primary care physician during COVID, during 2020. And his nurse practitioner had just had a baby in the middle of COVID and wanted to make sure that her kids were protected from everything as well. So chose to work from home and work virtually, which was nice because, she's not leaving the home. She's not risking her kids getting COVID and getting exposed to anything. But you just said it's only as good as their home Wi-Fi. That's exactly what that particular situation was. She was literally in front of her computer at her own house, having conversations and making suggestions, advice, and putting it into their CRM. So, again, that's like everything you would hope everything's protected. But again, that's a level that was not monitored, and it was for COVID that it was available there. Something else that you and I talked about, which goes back to this exact situation, is a question you normally would have just called to your doctor and said, hey, I've got a really quick question. I don't know if I should come in or not. It potentially could turn into a telehealth appointment. And now all of a sudden you're getting billed for a question that you wouldn't have not gotten billed before. So she was answering the phone as a nurse practitioner. Maybe those calls would have been a simple like, hey, yeah, you should come in, or no, you shouldn't. Now it's turning into a billable appointment.
Absolutely. And I think that's been the joke forever. I remember seeing as a kid, even like a comic strip in the newspaper, guys in the doctor's office, his neighbor happens to be another doctor, pokes his head and say, oh, I didn't know you were here. How are you doing? And, the guy says, hey, I'm great. Next thing you know, he's got a bill, $75 for a consultation.
There you go.
And that's kind of the reality now. Every conversation you have with your provider is potentially a billable conversation. And that, not that we're saying by any means that doctors aren't providing valuable service and shouldn't get compensated for that. But like you said, a real quick, yeah, you probably ought to go to the ER, or yeah, that can probably wait till tomorrow, used to be a courtesy call and now could be a billable call.
Correct.
One of the other things we talked a lot about was in preparing for this episode is kind of hesitations in care. If someone's using telehealth, especially as we look at some of these more chronic need cases, someone's using telemedicine because it's difficult for them to get out and about, difficult for them to access care at an actual in-person appointment. Is that going to make providers kind of second guess some of their course of treatment? Is it going to make them be more hesitant to order lab tests or suggest other things that might require the person to get out of the house with that predisposed knowledge of, hey, they have trouble getting out of the house. That's why we're doing telemedicine.
Yeah, you and I actually were talking about that because we talked about how beneficial it is for someone who maybe, like you said, is struggling to get out of the house. Especially if you're a caregiver, you're taking off work, you're coming over there, you're helping them get dressed, you're helping them get ready. Maybe it's just, they can't get dressed themselves, so you're helping them with a lot of ADLs. And then all of a sudden, to get them in the car, get them back in a wheelchair or whatever, get them into the office, it's a whole day adventure, opposed to getting on the phone, having a telehealth appointment, and maybe it's an hour of your time. So that's good. But the bad thing is now, as a doctor sitting there talking to that person with the chronic condition, knowing that they have to take an entire day to get into maybe get lab work done or go get x-rays or whatever the case may be, are they going to hesitate to order that test or order that lab, knowing that it takes a whole day for that person to get there and the caregivers to take off and everything like that. Whereas if you were in person, that person was able to get to you. They are in front of you. You're not going to hesitate for a second to call something else.
Yep. And I think that's one of the big issues is there are so many things that cannot be done over telemedicine. And that's not a knock on it. It's just you can't draw blood through the phone. So there's a lot of things that still require some kind of in-person visit, whether that's maybe a home visit or whether that's coming to a lab facility or some other type of area. But there are things that must be done in person. And, in addition to affecting access to care, affecting billing, they're, deal with the same kind of issues that every other aspect does. Price transparency is not always very good with telemedicine services. Is it being billed simply as a primary care visit? Is it being billed as a consultation? Is it being billed for various diagnostic codes? There's not a lot of transparency in exactly how things are billed. And unfortunately, in some cases, it's not even the physician's fault. There are a lot of challenges in understanding what codes can be billed for telemedicine and how to bill certain things if it's being done telephonically. Yeah,
we went from ICD-9 to ICD-10, and that was only a couple of years ago. So going from, small number of codes to literally thousands of codes that they can pick from. I think we were even joking. There was one, it was caught fire by falling out of an airplane or something like that. Like there's so many detailed codes that you have to figure out and sort through. So having a whole new way of doing business and having to teach and train your billing and claims department how to handle these now telephonic appointments. Maybe they're not coding it correctly. Maybe they are. But it's one of those situations that it's just a whole new realm of billing. And like you said, it's not a knock on the doctors at all. It's just that it's a whole new way of submitting a bill and how do you bill it and what code do you use?
Absolutely. Well, and I think something that we've continued to talk about in other episodes and then definitely affects telemedicine is if this is about access to care, does it matter in a rural area? I know we pulled up one day, Federal Communication Commission has some really neat maps if you ever want to check them out. Particularly one map cross-referencing access to broadband internet and access to physicians. And in looking at that barriers to health, there are so many parts of the country that both have no doctors and no broadband, or have very limited access to one or the other.
Right. No, it was actually a very interesting map to take a look at because that's a huge part of, like we were saying, if you don't have broadband internet, you maybe can make a phone call, but you can't do the virtual appointment and not able to actually do the high speed options, which if that's the case, then is that causing rural hospitals to fall behind with a lot of the telemedicine options? Because like I mentioned, my dad had his nurse practitioner doing everything virtually, but we live in Columbia, Missouri, where, for the most part, there is broadband internet. If you lived in a very small town in Missouri, would they even have that option to provide telemedicine? And in a world where that's an option and a lot of people are utilizing it, now that's just another knock to those rural hospitals of something else now that they can't provide.
Sure. Well, and another big thing is lack of reimbursement. So every state has a little bit of different rules in terms of Medicaid reimbursements and things like that. As of, and granted, this is some older data, but 2018, only 9 states were reimbursing 3 key telehealth modes of care. And that has, of course, improved with flexibilities from the pandemic and probably will continue to see those flexibilities. But still, that uncompensated care is something that we keep hearing in terms of hospital solvency and hospital success and other providers as well. So making sure that they're getting compensated. And again, make sure clients know what they're going to pay when they use telehealth services. Of course, we've seen it as an add-on, whether it's a 24/7 nurse line or actual telemedicine or working with their primary care doctor or specialist on telemedicine, but just really working, and this is a call out to agents everywhere, make sure you understand, and your clients most importantly understand what they will pay for telemedicine visits. Make sure that they're understanding how those copays will work, or if it's a co-insurance, and what the aspects of their plan are that can assist with that.
And I think also just making sure that they are aware of what is available telehealth wise to them too. If they do have Medicare Advantage, for example, a lot of those do provide the nurse hotlines. If they are dealing with a mental issue, maybe a suicidal thought or something, having that available and knowing that they have that option could be a game changer of whether or not they're alive. So, making sure that they know what options they have and also how much it costs, I think is super important.
Absolutely. Yeah, costs are fantastically important. And I think another thing that kind of back to the provider side of it in offering and providing care that especially people need to be cautious of, providers need to be cautious of if they're contracting out these telemedicine services is licensing.
Right.
During the pandemic, we had a lot of flexibilities over state licensing. People were able to work mostly across state lines with a couple very limited exceptions. For telehealth, with the end of the pandemic, those flexibilities went more to a state-to-state basis. So there are a few states that have kind of gone back to the old method of you need to be licensed in this state. Most of them have kind of maintained these flexibilities, but it also does still provide a little bit of inflexibility in access to care if you could only access doctors that are currently licensed in your state.
It really does, because some states have a lot. When we were looking at a lot of those maps, a lot of states have tons of doctors and some of them are very limited, especially in the rural areas. So that's 100% a good suggestion as well. So I think in terms of action plans as an agent, that's how we always want to end, of just what can you take away from this? Because we gave you a lot of data, a lot of information. As an agent, how do you take what we talked about in this and bring it back home? So I think in terms of, as an agent, making sure clients are aware of what options they have for telemedicine if they are enrolled in a Medicare Advantage plan. Also, there's a lot of private companies that do telehealth if the client is interested in something like that. Also making sure that's another networking opportunity with a lot of your local doctors to see if they offer telemedicine. I think that does nothing but improve your credibility and also help with, the doctor knowing that your services are even available. So being involved in your community, knowing who offers it, who doesn't, is huge. And then also the limitations of telemedicine in terms of prescriptions. I know that's been something you and I've talked about, of
Sure, absolutely.
which ones can be and can't be prescribed.
With the recent DEA ruling, we still have a few flexibilities on scheduled drugs through late this year, but definitely something that we're going to be keeping an eye on in terms of accessing some of those controlled medications, some of those narcotic medications, and then also kind of rules on establishing care. Can your PCP, your primary care physician, can they be strictly telemedicine visits, or will you have to have at least one in-person appointment to establish care, maintain certain medications, things like that? I think the biggest takeaway for all of this is that telehealth is still a young industry, and it's going to require a lot more research, a lot more regulation before it really kind of brings itself into the future. And again, we're not only talking anymore about just speaking to a physician, we're even talking about things like artificial intelligence and bringing in things like AI chatbots. I know we talked about an article the other day.
Just this week talking about AI chatbots, and it was something like not quite 50%, but almost 50% of people were willing to talk to a chatbot about their health, which is just so crazy. So we're coming a long way from the horse and buggy doctor with their little toolbox and their stethoscope.
Absolutely.
But it's definitely something that has been in the news recently, has been a hot topic. And of course, because of the public health emergency during COVID and now ending, it's even more prevalent in the news. And we'll continue to watch and monitor any changes that comes with telemedicine. But it's a new thing. So we're going to see a lot of changes and a lot of debate and a lot of concerns and a lot of good that come out of it as well.
Absolutely. Like we said, there's a lot to be considered here, a lot of things that you need to be aware of to assist your clients in accessing and utilizing telemedicine in an effective way. And most importantly, as we wrap it up today, just be aware of everything going on in your local community, which doctors are maybe working with and providing telephonic services for your clients, and helping those clients of yours that do have difficulties get access to the care they need, while understanding those limitations and what other options may be available in terms of things like transportation benefits and other benefits that may be included in their plan to get them to those in-person appointments as needed.
100%. So thank you so much for tuning in to this week's podcast. And we will catch you next time on Medicare Industry Insider.